So friends, the first subject we are taking is that promotion or pharmaceutical marketing or marketing as such is a profession and not a job. So what is difference between job and a profession? You say, what is your job, what is your profession? The one difference, basic difference is, in profession, you can grow to the level you decide. It is not linked with your age or with the time or with other things. Here you decide, you achieve, and you reach the level you want. For example, law is a profession, medicine is a profession, marketing is profession, acting is profession. There are doctors practicing since 40 years, sitting with the same degree what his colleagues they had, MD or MS, sitting in a clinic, earning just small money, and very few people patient comes. And on the other hand, there is another doctor for whom you have to take appointment 2 months, 3 months. They are overbooked. He had the same books he read, and whether it is anatomy, physiology, same medical college, same teachers, but he created value like that. Same is true in law. There are lawyers charging $100 per hour. They go in same law school. And there are others, with a black coat, they are standing below a tree and they just make affidavit and nothing, and they don't achieve anything big. Why? In medical rep also. There are medical rep, they become very quickly within 10 years marketing manager or even on hire as a director. They make their own companies. Same medical rep, same company, same training. So what is difference? The difference is, gentlemen, the one who takes this as a profession. For him, he has a vision, he has some goal, and he works for it. He puts everything into action and achieve that. So in profession, the important thing is not just knowledge, what is books or medical college or teachers, same, everything is same. The difference is application of the knowledge, that is the skills. We will discuss for marketing what are the skills required for a promoter. So skills become the multiplying factor. So remember that for you as a promoter or as a salesman, although there is a difference, but as a broad term, as a salesman, for you are not ordinary salesman. You are a professional in marketing. You are a professional. If you use your knowledge skillfully, within 5 years, 6 years, you become somebody at a very higher level. I know medical rep. Within 3 years, they become area manager. Within all that, they become regional manager. And many, they join as a medical rep and they retire as a medical rep. It is not bad, because he decide to remain at that level and be successful. But there are also some, they decide they take this as a profession. So friends, for a professional, there are unlimited scope. Like sky, they say sky is the limit. There are unlimited scope for them to grow in terms of money. They earn, their salaries can be 10 times within 3 years, even more. And social status, they respect, and the success they achieve is not bounded by time or by other. They decide. So friend, this is a character of a profession. Another thing which my friends in pharmaceutical industry should know, that you are doing something socially good. You are not selling tobacco or that black label, or a shoe. You are selling medicines, which is a question of life and death. So in pharmaceutical, you must be proud. We are a part of healthcare system of any country. Without us, what are medical colleges or doctors they can do? So remember that be proud of your work as a promoter in pharmaceutical marketing. That you are marketing something is essential, something which is required in industry for the living being, for the world. It is not making anything like we can survive without rado, without watches. We can survive. We can survive without black level or blue level or any level. We can survive without clothes. What is there? We don't need expensive the Gucci and all these the things. We don't need expensive and nothing. So what is the basic like food? Medicines are the basic necessary for every human being, whether it is war or peace or poor country or developed country. Every human being needs pharmaceutical products, and we provide them those important products for their survival, for their sustenance, and for their longevity. So my first lesson or first advice to you, be proud of your work as a promoter or in pharmaceutical industry, whether you are director or you are owner at any, you are distributor, you are in dispensing, any field you are part of healthcare system. This is my first point, any country. Coming to the second point, that what is the role of a good promoter or role of a marketing person, or the basic, the step is a promotion, is a medical rep. So what is your basic job? Remember, on one side there are medical colleges, there are doctors, there are healthcare establishments. Other side there is pharmaceutical industry, which is investing billions of dollars to develop new drugs, new treatment modalities, and they produce drugs, they manufacture drugs. So between doctors, hospitals and between pharmaceutical industry, you are the link in between. So remember, as a marketing person in pharmaceutical, you are not doing ordinary job, you are a link between these two. So what are the needs of doctors, what are the needs of market, or what are the problems with the doctors with the existing drugs, what are the side effects, or what are the good things to transmit these to the industry, and then based on those they work and develop and remove those shortcomings and develop superior drugs. And the information about those superior drugs you transmit, you give to doctors. Without you, believe me, whatever a doctor say, out of ego, he will never say that he has learned from a medical rep, because they are MBBS, MD, DM, and this. Because of ego, they will not agree. But the fact is, the source of information for a doctor, learned doctor, is the pharmaceutical man, is the promoter. And if you have good information, anything new information, everybody listens. Everybody till today listens. Even on old drugs, they listen. Aspirin, this was discovered 100 years before, more than 100 years before in Germany by Bayer. What is new now? Nothing, 100 years. But still, last 20 years, the new pharmacodynamic effects like anti-atheroglytic changes were known. And now aspirin is no longer used as an NSAID, but is used more as a cardioprotective drug to prevent the process of atherosclerosis or like that. So you are the one as a pharmaceutical promoter who gives information from doctor to company and company to the doctor. So you are the vital link. Friends, be proud. Whatever anybody tells you, but without a medical rep, without a promoter, industry cannot run. Even those who are in a generic business, they sell cheap generics. Even they will employ some medical rep, some promoter, okay, to give information, if not to doctors, at least to the pharmacy, about quality, about efficacy. Because if pharmacy is not convinced, is not sure about your manufacturing accreditation, your plant is WHO approved or FDA approved or UKMHRA approved or PIC approved, who will tell this to pharmacy that my company is good? my plant is approved by this, what I make is quality product, so which is dependable and patients can use it. And that information, when you give to the pharmacy about your product, and you tell them that this is the quality with affordability. Don't say cheap is not a good word. My drug is cheap or cheapest. No, we don't sell cheap things, and cheap things are never respected. Affordable, yes, as per the country, affordability is important, because per capita income of India and America is not same. These people, they are using paracetamol $1, one tablet, Tylenol or others. In India, in $1 you can buy 100 tablets. So these differences are always there, friends. So this is the nature of the job, that you are the vital link between industry and the pharmacy and the medical profession. So be proud of your job. That is the nature of your profession. Coming to that, and now when you promote the products, we will go more into that in our next episode. We will discuss that. So today, I think very small video we are uploading, just telling that be proud as a pharmaceutical person. Thank you.